Okay, I want to take a few minutes here to go over the different types of dental cleanings. Although this is just a quick overview, I highly recommend that you become very familiar with these services because it can get pretty confusing for the patients, especially if we as providers give them conflicting information. One important factor when discussing hygiene services with patients is to make sure you don't use sophisticated terms like prophylaxis or debridement. Patients will understand either a basic cleaning or a deep cleaning, so you can structure your presentation around these terms. The type of cleaning is determined based on the pocket measurements and other clinical observations like tartar buildup, gum bleeding, and evidence of bone loss on the x-rays. A healthy patient, meaning someone who has no pockets or gum bleeding, gets a prophylaxis or prophy, which is a basic cleaning. A basic cleaning usually involves the removal of stains and buildup above the gum line. We do light scaling with hand and sonic instruments, and their teeth will get polished and flossed. We also take some time to go over oral hygiene instructions and other factors that may put the patient at higher risk of cavities and gum disease like crowded teeth, poor diet, extensive dental work, gum recession, etc. Sometimes it's not easy to figure out if the patient needs a basic cleaning or a deep cleaning because they may have too much plaque or tartar buildup and stains and inflammation. In these cases, we do something called a full mouth debridement. And the purpose of this cleaning is to get rid of the buildup and inflammation so we can do a proper evaluation. Again, patients understand the notion of a basic and a deep cleaning. So I usually tell them that their gums are swollen and I would prefer to do a general removal of buildup that will let me take a better look in order to determine if they will need a basic cleaning or a different approach. If a patient has deep pockets, bleeding, and evidence of bone loss, he or she has active gum disease and will need a deep cleaning. There are different therapeutic approaches depending on how serious the condition of the patient is. These patients will require removal of tartar buildup below the gum line and smoothing of root surface imperfections. This is a procedure that will usually require 2 or more visits, and the patient will need to be anesthetized because the gums are usually very tender and the roots have many exposed nerve endings. Another kind of cleaning that we do is the perio-maintenance. And this is the cleaning that we do as a follow-up on patients that have a history of gum disease or gum treatment. The perio-maintenance is a general cleaning that will require revisiting areas that have been a problem for that patient in the past, and we make sure to remove any debris to enable an adequate healing process. In the next video, I will describe in more detail the different categories of deep cleaning depending on the patient's condition.